It's one thing we should all agree on. There's a drug crisis in America, and we have to stop it. But it turns out some Democrats would rather play politics.
Well, the author of Sheer Madness, From Federal Prosecutor to Federal Prisoner, Marine Corps veteran and former opioid addict, Andrew McKenna joins us right now live on the couch. Good morning to you.
Good morning,
Pleasure
Andrew.
to be here. Thank you.
So it is unfortunate that the opioid crisis would be political.
Right, and what it's going to do is going to cost lives. I mean, that's the dead reality of what's happening. What we need to do is come together as a country, nonpartisan, and attack this problem, because we're losing 33,000 more, more or less per year in overdoses. And what's happening is the liberal elites essentially are saying Trump's doing nothing about this problem, and it's absolutely false. And he's giving $500 million in grants to states, directly to states. He's basically closing down the Office of National Drug Control Policy, which is a White House office, which is a waste of money and ineffective. But the way they're painting it is that, well, he's closing down this office and taking the funding, but he's not doing that.
Well, Andrew, there are some claims out there. We're going to have you tell us whether they're fact or fiction.
Sure.
That's right. The first claim is Trump has done nothing to address the opioid epidemic.
Right. Well, that's absolutely false. What he's done is he's appointed Tom Price, who's Secretary of Health and Human Services, to attack this problem and to go into the communities that are hit hardest and to disseminate some of these funds to these communities. He's also, as I said, he's shut down ONDCP, which is a waste of money, saving hundreds of millions of dollars for their budget and redirecting those funds to the states where they need them most.
What about Governor Christie? Didn't he put a commission there for Governor Christie?
He did indeed, and I think that was a smart move. I mean, politics aside, Governor Christie is, former prosecutor. He understands this problem. You remember during the primaries, he talked about a relative that was struggling with addiction. It was very moving, and his heart's in the right place.
All right, Donald Trump, who you say his heart is in the right place because he is doing something, he tweeted this: the Democrats don't want money from budget going to border wall, despite the fact that it will stop drugs and very bad MS-13 gang members. So here's another one of the claims. Trump's tweet about Dems' resistance to funding the wall is allowing heroin into this country is false.
We have to look at the wall in a broader perspective. We're not necessarily talking about brick and mortar, right? We're talking about higher levels of surveillance, trucks coming through, because we know that's where the bulk of it's coming through. It's not coming on the backs of people trying to get into this country. Okay, that's one problem. But what's happening is coming in through vehicles, and the heroin and the opioids are mixed in with legitimate commerce and legitimate products. We have to expand that. That's where the money has to go, and I think Trump's on board with that, and he understands that. The other thing is aircrafts, right? Planes, trains, and automobiles. That's how this stuff is getting in. And so I think the virtual wall, the wall, whatever you want to call it, is a step in the right direction. It's going to be a mix.
All right, the last one is, go ahead.
You had. So I was going to ask him something about his personal life.
All right, just real quick, he's not helping, Donald Trump, the President of the United States, is not helping veterans with their addictions.
Ridiculous. He's completely vetted to help veterans. The Veteran Choice Act allows veterans to go into the private practice if they can't get an appointment within 30 days with the VA. This is the bigger point. What has to happen is Tom Price and HHS has to look at treatment programs, right? Because that's where the buck stops. If we put somebody into a 30-day treatment program that's not effective, then we're absolutely doing them a disservice. At addiction campuses, we'll put somebody in 30 days and we'll stay with them for an entire year, figuring out how to get their lives in balance. Addicted people, their lives fall out of balance. So a balanced-led curriculum gets them to that point. It's got to be the long-term approach.
Andrew, unfortunately, you know all about this. I'm glad you're speaking publicly about it. But tell the folks at home how you went from a Marine to a drug addict.
Well, it's interesting. I hurt my back in the Marine Corps. I couldn't do anything about it while I was in the Marines, but when I went to the Justice Department, and I speak publicly, professionally across the country about these issues.
Written a book about it.
I wrote a book. So, once the prescription pain meds went away, and I graduated to OxyContin, which is nothing other than heroin in a pill. And I was just telling Steve before we went on, those withdrawal symptoms were so powerful that I turned to heroin on the street. I'm not proud of what I did. I committed crimes to get money for drugs. I committed crimes because I was angry and depressed. It's a long time ago. I wrote about it, but I speak across the country about it.
How long does it take you to get off these drugs? When you make a decision to get off these drugs, how long does it take you to get from that point to healthy again?
The key, it's a great question. The key is the treatment piece, as I talked about. These 30-day programs, they'll take you in, take your money, and dump you out after 30 days. We need evidence-based treatment, like Addiction Campuses uses. And we have to stay with that person. If we know statistically, if we can get the addicted person to the year, then the chances of success, skyrocket.
Wow.
And it's a beautiful thing to see somebody come out of that fog.
Andrew McKenna, thanks so much.
My pleasure. Thank you very much.